talk a little bit about ecto and endoparasites. It is the summertime and we get so many phone calls and questions about why do I need to do a heartworm test, or why do I need a stool sample, and does my pet actually need a topical versus an oral prevention? And there's so many things out there on the market. So I figured we're going to briefly just talk about some differences that are out there that you can make the best decisions for your pet, for both dogs and cats. So the two big differences is an ectoparasite versus an endoparasite. So an ectoparasite is one that lives on the surfaces of your dogs and cats, such as fleas and ticks. And so we know that fleas can be debilitating to your animals. We know that they can cause flea bite anemias, horrible allergies. It's a nasty infestation to try to get rid of. It's contagious to other pets, and you guys can get bit by them. And then ticks is a very bad problem, especially that up here in the Northeast in our region. So we see a lot of tick-borne diseases such as Lyme disease, Ehrlichia, anaplasmosis, Rocky Mountain spotted fever. The list can keep going actually for it. So those are the ectoparasites. So with that being said, it's really important and paramount to have some sort of a topical or oral prevention for your dog and cat too. Those are really important to help maintain them either once a month or every 3 to 6 months, depending on the product that you use. In addition to the other parasite that you can see that's associated with either being an ectoparasite would be mosquitoes that causes heartworm disease. And believe it or not, heartworm disease can be found in both dogs and cats, and that is transmitted through a mosquito, and it can be found anywhere throughout the country. More prominent in dogs, but we definitely do see our cases with cats and even indoor cats. Excuse me. So some of the products that I have for you today we're going to show and discuss. So I have a list of some of the products here for you just so you can get an idea. There's so many that are out in the market, and so many pet owners are really confused and inundated with all the marketing that's out there. But I brought today a few of the products that I think are of interest and that we as veterinarians certainly recommend. Probably the most common one that you see out on the market is Frontline, right? The generic Fipronil. It's commercially available over the counter throughout many mass markets through big box retailers as well as mom and pop stores and pet stores and so forth. The Frontline, however, has been out for many years, and unfortunately what we're seeing as veterinarians, and particularly in this area, is a lot of resistance to the fleas and ticks. Does it work? Of course, it works, it has its efficacy, but as a result, we do see other products that are out there just because we're seeing some breakthrough problems with this product. So yes, it's a great product to use. It may be best for your pet. So the topicals is certainly another area, product to certainly use. The other one that we have is something called Parastar, and this is also used for fleas and ticks. It's a topical that goes in between the shoulder blades once a month for your pet. Again, you just have to be careful with either bathing a couple days before or swimming them as well, or getting groomed, because it is a topical. It does have a fast flea kill, which works really nice. So this is an excellent product that we do recommend. There's also Canine Advantix, so we just have to be careful with a multi-pet household if you have dogs or cats present. Probably the more popular one that we're seeing, especially this summer, being that our hospital, we live right over here by the shore, is what's called NexGard. And what's nice about this is that this is an oral chewable tablet that's for your dogs only, not for cats, but it's a chewable tablet once a month, and it's used also for fleas and ticks. So it's great for especially us in this area where you can swim your dog, you can take him to the dog beach, you can take him out anywhere you want in terms of grooming, getting bathed or whatnot, and you don't have to worry about that product. And to also know and ensure that the adequate dosage was also applied towards your dog. So that's excellent. So this has been a real popular product that we've been seeing with very minimal side effects. So that's something to think about. The other thing that some pet owners like are the collars. So we have one product here, it's called Scalabar. There's other products that are tick collars that are good for up to 8 months that you might see. It's certainly a valid option to use. Some of the dogs, however, don't like the smell of it around their neck that's lasting that long. We do see some breakthrough problems every now and then, but it certainly is a valid option to use for fleas and ticks. So that's basically the basic products that are out there. So there's either topicals, collars, as well as now oral chewable tablets for the ectoparasites for fleas and ticks. So we just talked about the ectoparasites. We also now have to talk about the endoparasites. And what are those? So those are the reasons why we want to see little poopies from your babies. Those are the ones that are found internally that can cause horrific problems such as weight loss, diarrhea, inappetence, vomiting. It can get nasty. So, and unfortunately we see it all in this profession. So endoparasites are parasites such as roundworms, hookworms, tapeworms, whipworms, and there's a whole bunch of other multitude of different parasites that we can see. And therefore, it's important that we use some sort of a prevention that your veterinarian would certainly recommend for whether it be indoor or outdoor cats, as well as dogs. So we have a whole multitude of them. And the reason why is because some of these parasites are actually zoonotic. And a zoonotic disease is something that you and I can get from our pets. So that can be transmitted from our dogs and cats to us. And there's certain parasites that we could get from them. So I'm going to show you a couple of products that we recommend and that your baby should be on at least once a month. Through your veterinarian is called Revolution for both dogs and for cats. So the Revolution for the dogs is a once a month topical product that's used for the prevention of heartworm disease as well as intestinal parasites. So it also takes care of flea infestations as well. So it does a lot. It's an excellent, excellent product for 6 weeks of age or older, and it's used for also ear mites, certain mange such as sarcoptic mange, and prevents certain intestinal parasites too, such as roundworms and other parasites. So that's a great one. And then the same thing for cats too. This is also heartworm prevention and a flea prevention as well. Topical once a month. It's great for both indoor and outdoor cats. Yes, your indoor cats could absolutely get a flea infestation as well as intestinal parasites. So we always recommend indoor cats receiving a topical prevention. And this is the one that we usually recommend because it's the most bang for your buck. So this is an excellent product called Revolution. The other products that we have, one is called Sentinel, and that's a once a month chewable tablet that's also for heartworm prevention as well as intestinal parasites too. So it takes care of the roundworms and hookworms and whipworms, and it also takes care of fleas. So this is a really good maximal dosing thing in terms of another big bang for your buck. Keep note though that this doesn't take care of the tick prevention. So that's why we usually recommend two different products. So either the Sentinel once a month or the NexGard once a month. So you need that added coverage for the tick prevention, especially in our area in the Northeast. But Sentinel is great once a month given with food. And then the other product is HeartGuard. This has been out many years. It's an excellent product, very efficacious as well. It covers heartworm disease as well as intestinal parasites. It doesn't take care of fleas, but the palatability for something like this, if your baby has a hard time receiving maybe a chewable tablet, this is just a meat tenderizer. A lot of them tend to enjoy this taste of a product as well. So this also works well. So I have one of my colleagues and dear friends, Dr. Patricia Leff here at Bricktown Veterinary Hospital, and I figured it'd be fun to play a cool little quiz game with you guys. So we have a question we want to ask you guys. Go right ahead.
So our question is which of the following is a zoonotic disease? And the choices are A, fleas, B, ticks, C, roundworms, or D, heartworms.
What do you guys think?
Alright guys, so the answer was C, it was roundworms. Hopefully you got that one right. Important things to remember are just basic hygiene. Remember to make sure that you're poop scooping and washing your hands, keeping things cleaned up. Roundworms are transmitted by a fecal-oral transmission. They generally tend to affect immunosuppressed individuals, so younger individuals or older individuals. So really basically, as long as you're washing your hands and keeping good hygiene, you shouldn't have a problem.
So thanks for checking out our video. Hope you learned something good. We hope you guys have a great summer, especially stay safe with your pets. Don't forget to follow us on Twitter.
And like us on Facebook.
And check us out on the web too, www.bricktownvet.com. Take care everyone.
Have a great summer.